Well, good morning, everyone. My name is Aisha Dixon. I'm the director of the UCLA Emeriti Retirees Relations Center, and we are one of the first Emeriti centers within the UC campuses. Our department does pre-retirement planning for faculty and staff, and then post-retirement campus engagement, whether it's anything about education, research, services, anything that we can help support the aging landscape of a college campus and support retirees' involvement with the campus and the community at large. We have some great guests here, so I'll turn it over to Maria to introduce our speakers today, and we'll get started.
Hi, good morning. Thank you, Aisha. My name is Maria Lubrano, and I work under Aisha in the Emeriti Retirees Relations Center, and I want to welcome you to our ERRC Cares Zoom presentation this morning. We do have two presenters. We have Delia Cortez, who is a licensed clinical social worker with the palliative care. She does social work at the UCLA Med Center and much more, and she can maybe share a little bit more about herself as she does her presentation. And we also have Monica Moore, who has her master's in gerontology, and she's a community health program manager at the Mary S. Easton Center at UCLA, and we'll also ask her to share a little bit more about herself as she does her presentation. Other than that, thank you to our participants for joining us, and hope that we get lots of good information today.
Great. Thank you, everybody. Thank you for being here. I'm going to go first here. So let me just get this all up and going. Again, thank you to Maria, thank you to Aisha, and thank you to everybody, to the ERRC for hosting Delia and I today. Come on here, computer. There we go. Okay. So as Maria said, my name is Monica Moore. I work for the Mary S. Easton Center for Alzheimer's Research and Care at UCLA. I coordinate our community education as well as manage our 9 caregiver support groups. So they are virtual groups and for different types of relationships, all for people though caring for somebody with Alzheimer's disease or another form of dementia. So our groups are open, and if you are at all interested in our groups, my contact information will be at the end of the presentation, or we could put it in the chat as well. So today, Delia and I are going to tag team here and do a presentation talking about strategies for caregiving. You know, please feel free to put your questions in the chat while we are presenting. And also, if you have a question that really pertains, I'd love to try to engage you during the presentation as well. So you're not just sitting here and listening to us for an hour and a half, but it's more of an engagement. And if you have any questions, we want to be able to help answer those, because also conversation helps spur thoughts and ideas, and really is where we can see how everyone here can help support each other in your journey, which we, of caregiving, if that is one that you are on. So sort of our goals for today is we're going to talk a little bit again about caregiving, went too fast. Identify those who are caregivers. We're going to discover tools for coping with caregiving, and we're going to learn how to initiate advanced care planning discussions. That's something people are always afraid of. Everyone knows they need to do this stuff, but how do we start the conversations? So that's something that Delia is going to speak about. And then we're also going to leave you with resources. No point to have a presentation and just say, okay, good luck, you're on your own. So we want to be able to leave you with some resources so that you can have some support for this. So I like to open with this quote from former First Lady Rosalind Carter. There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. So we all will fall into one of those categories at some point in our life. And so we all will experience the world of caring for a loved one or being the one that is cared for. So this is why, we really feel it's so important to have these conversations about caregiving and about care planning, is because realizing that none of us are going to get out of this life without being affected by caregiving in some way. So initially, just want to, give you some information, level set everything a little bit here, and talk about who is this population that is at risk? Who are these caregivers? And when we use the word caregiver, we're not talking necessarily about professionals. We're talking about all of you. We're talking about people who are caring for a loved one, for a parent, for a spouse, for a sibling, maybe also for an adult child. So we look at currently 44 million Americans over the age of 18 provide unpaid care for older adults and those with disabilities. 44 million. The estimated value is about $306 billion annually of the care that these people are putting in. So we see how, this is actually double the combined cost of home health care as well as nursing home care. So how crucial these at-home family caregivers are to our society, but also looking at the huge cost that does come with it. Most caregivers are not prepared for this role, right? If you are a caregiver here, did you take a class to try to figure out how to care for your partner? No, probably not. Did you take a class as to how to bathe your father if this is something that you have to do? No, people are not prepared for this role. And this is something people often come to me, and I'm sure with Delia as well, they say like, oh, I don't know. Oh, I didn't know. And we say, of course you didn't. And that's fine, because you shouldn't have known. There's so many things that you are faced with in your life, but you're not prepared for some of these. And that's why people like us are around, is so that we can help give that information. We can help with providing that support to everyone who is trying to figure out this world of how to be a caregiver. And, it's very important to realize as well that the health of the caregivers is often at risk. More than 1/3 provide intense care while they are dealing with health problems themselves. So again, think about yourself. Think about when was the last time you went to the doctor for your medical needs, not because you took a loved one. And so we realize how caregivers do suffer as well. And so who are the caregivers? 20 to 25% of family members are involved with elder care. So here we're talking about people over the age of 65. It's majority women. A quarter of the women caregivers are caring for their parents as well as their children at the same time. Really, this world of the sandwich generation where, and it doesn't necessarily have to mean that your parent lives with you. It just means that you are responsible for doctor's appointments. You are taking them, to pick up new prescriptions, helping them with physical therapy, helping to order groceries, all of these things. This is all what encompasses this world of caregiving. It's not just, helping mom shower. That's one part of it, but that's just one part. There's so much of this other part, this emotional part as well. And even it could be as much as if you are a long distance caregiver, your mom lives in another state, but you call and you check up and you ask if she's taken her medication. You've asked how the doctor's appointment went. You ask how she's feeling. You stay up on these things. You pay attention, and that takes time and energy as well. So really want to make sure everyone understands that caregiving isn't necessarily always hands-on. It can be long distance. It can just be you live across town, but you work, or you are fully retired and enjoying the true benefits and the true joys of retirement, and you don't have time. Because sometimes that's just part of it too. Just because someone isn't working doesn't mean that they just sit around and have nothing but time on their hands. When we look at the world of caregiving as well, 50% of these caregivers work full-time outside of the home. And 72% care for either a parent, a step-parent, a mother-in-law, or a father-in-law. So you really do see this world of caregiving and how often it is somebody who, sort of like the responsible adult. I think sometimes it falls on their shoulders, no matter what proximity is. And oftentimes it is the women who are who take on this task. 52 million caregivers provide care for people over the age of 18. So this is also talking about people who are developmentally disabled or adult children who need care. And I really like this last part. You know, a typical caregiver is a 46-year-old woman who works outside of the home. She spends 20 plus hours a week caring for her mom and is either married or living with her partner. And so whether this pertains to you or not, you know, maybe think about what your family structure is like. You know, do you have an adult children who's helping to support you in your caregiving as well? Because it's not always just one caregiver, it's often multiple, right? There's often the primary, and then there's the secondary who may help. There's this, let's say if it's a spousal, you know, a spouse caring for a spouse, but then the adult children are still very much involved, hopefully. So you see how this really does take on a lot of energy and a lot of focus from other people as well. So my focus is dementia care. That is, you know, what I focus on in terms of the caregivers that I work with. So I like to show this statistic. And ultimately, if we're talking about older adults, most likely they are going to be experiencing some form of dementia, some sort of cognitive decline. So in California, those who provide unpaid care to family and friends, among those who provide unpaid care to family and friends living with Alzheimer's and other dementia, more than 60% provide 20 or more hours of care a week. How many of us really have an extra 20 hours a week that you can just put towards caregiving? You know, that's hard. Sometimes I even find putting in an extra 5 hours of you know, something is difficult. And, you know, you see how it really does take up a lot of time. So when we think about, you know, again, I'm going to talk a little bit more about specifics of dementia caregiving, is that they do ultimately have a longer duration of caregiving than those who are caring for someone without dementia. Because of the fact that Alzheimer's disease and other forms of dementias really are slow, progressive diseases, that there is a much longer time where the needs continue to increase over time. You know, at the beginning stages, somebody might just need some basic help with reminders and some easy sort of supervision. Hey, did you take your medication? How are things? Let's go to the grocery store once a week. But then as a person progresses through the disease, what they demand upon their caregivers is much more. And it does ultimately become full-time and physical as well. Also, people with dementia ultimately have an increased burden, increased challenges, you know, with the degeneration of the disease. It's physically hard, it's emotionally hard. And this is really where we want to focus on caregivers being able to get the support that they need to especially help during this time. I'm going to just quickly. Okay, sorry, I saw that the chat had bumped up, but that's just Aisha putting some caregiving resources in there. So, okay. So while caring for a loved one, caregivers do often stop caring for themselves. And so now I want to talk a little bit about how this illness ultimately does affect family dynamics, how it can, you know, affect people personally. And, you know, I also, you know, I'm going to deviate just for a quick second, sort of so I have an idea, and I think this will help Julia as well. And I know some of you have cameras on. Great, thank you. I always appreciate that. So it looks like I'm not just talking to myself. And I know some of you are you know, cameras off, and that's fine. But just sort of asking, like, how many of you actually are caregivers at this point? You know, maybe put it in the chat if you are. Marjorie raised her hand. Okay. Just to get that idea so we know as well who our audience is. I think it always helps. So if you are caring for someone, if you put it in your chat and maybe just say who you're caring for, I think these types of things always do help us. So thank you, Tony. Let's see. Okay, great. Okay, yeah, great. Thank you. Yep. See, we see how it really does, you know, helping to care for a 90-year-old mother, caring for a 101-year-old aunt. Wow. Okay. But again, you see these relationships, you see how this really changes, and it's not always parents. Sometimes it's really good friends as well. So sandwich generation. Yes, Aisha, I get it. I get you. I understand this world. So thank you to those of you who are caring for somebody and for the work that you do. And for those of you who aren't, thanks for coming anyways. I think, all of this information is good to have. So I appreciate everyone entering that information in the chat. So thank you. So when we think about the world of how this affects our family dynamics, you really think about, especially siblings, right? Siblings are great, but sometimes, as I hear a lot of my support groups, everyone always has, we say, that brother, and it is often the brother who is there but doesn't help. If you need anything, let me know. But they never come around. So it really does fall ultimately, lots of the time, on one primary caregiver. Oh, Karen has 2 of those brothers. Congratulations, Karen. You are doubly blessed with those types of brothers. And yes, I know I'm fine with emailing the slides as well. So we can send the information. But yeah, you see like this, it's so hard, right? You have these different family dynamics. And, it's also what's your relationship with the person that you're caring for? Like just because it's a parent doesn't mean it's always been a good relationship. And that's something I think people forget about as well. So we think about, it's the emotional difficulties, think about how caregiving can be demanding and exhausting. And then you're faced with frustration. You're faced with frustration of lack of support, maybe from people, lack of understanding from people. And also just sometimes that world of where you feel you are truly isolated. And that is such a challenge, is that world of being isolated. You think about how it's hard to find the positive aspects of this relationship. So imagine the person that you're caring for. And most likely there is a reason why you stepped up. Most likely it's like love, obligation, loyalty. So it's like there's a reason why you stepped up. But then in the throes of caregiving, it could probably be really hard to remember is what were those positive relationships? Why are you doing this in the first place? Like, why you? Isn't there somebody else who could step up and do this? Does it have to be you all the time? And because the relationships have changed, because the person you're caring for has changed, and especially if they have dementia or Alzheimer's disease, they have changed. If they have cancer or other things, their abilities have changed. Their will may have changed, and you see that this difficulty and this challenge. And caregivers often forget to take care of themselves. And as I said earlier, you really increase your risk of illness. In one of the support groups that I run, one of the women, this group is actually for people who are caring for someone with young onset Alzheimer's disease. So this is Alzheimer's diagnosed before the age of 65. So we have a group just for these caregivers. And in this group, in the past, I think about 6 weeks ago, one of the spouses passed away. Because of this, she was having her own health issues and the stress of caregiving, and we think she had a heart attack. And so then, you see this, like this hit our group. We preach a lot of taking care of yourself. You need to take care of yourself. Come on, Maria, that, take care of yourself, right? But then you're like, yeah. But you really see how it does hit home, and it does affect even the caregivers in a way. And this woman, passed away suddenly. So you see how if she may have been a little bit more in tune to her body and paid attention to things, who knows? But just the world of stress really can affect people. Also, illness affects the family dynamics through depression and burnout, as I mentioned. Accepting assistance can greatly improve the quality of life for the patient and the caregiver. and not just the people who are like, oh yeah, whatever you need, let me know. If you need anything, let me know. Well, what you need to do is you need to let them know. You need to say, actually, yes, what I need is blank. And these are some things I'll talk about in the next few slides. And also realizing that support groups are vital. You're not alone. You need the help. You need the support. You need to find the people who understand and who truly understand. You may have friends someone who's been your friend for decades, but they may not understand what you're going through. But if you find another support group, if you find this, other people who do, they get it because they're living a similar situation. So now talk a little bit about some signs of caregiver burnout. How do we identify this? You look at change, we hear caregiver burnout, we hear these words, but what really does this mean? You can start to identify it by, you see a change in your sleeping and your eating habits. Maybe you used to be a very good eater and you always really took care of yourselves, but now you just grab whatever is there. And you don't have the time or the energy to actually get a proper meal. And you notice that your health is starting to decline, or you realize maybe I've put on a few extra pounds that I didn't have before. And that it is probably because of the fact that you're just grabbing something to eat. You're not actually having a meal. You're not having something nutritious. You're just putting food in your body. You might realize that you're sleeping too much or you're not sleeping enough. Staying up too late, and then while you're sleeping, you wake up with all those thoughts. Right? I think we've all done that. We've all woken up with thoughts in our minds like, oh shoot, I needed to. Oh my gosh, I forgot. So finding ways to focus on that and to set yourself up for success in terms of sleep every night. Another sign of caregiver burnout is really not being able to laugh or to feel joy. You're just so overwhelmed and you're just so frustrated. And you even wonder, like, what's your life? Like, what's the rest of your life going to be like? So you've given up all of this, you've paused your life, and then what? Another support group that I run, it's for young adult children. And so these are people in their 20s, 30s, and 40s caring for a parent with dementia. And there's a woman in this group who's 27. Her mom is in her 60s, diagnosed with Alzheimer's disease. And this woman says, I shouldn't have to be doing this. I should be able to be out at the bar and meeting people and going out with my friends. Like, I'm in my 20s. This is when I should be living my best life. And she got to this point of just being so just almost miserable with her caregiving responsibilities because she just felt such a conflict. And she ultimately realized that she was experiencing this world of caregiver burnout. She found a community for her mom to move to. And ever since then, she's been in a much better state because she says, I'm still caring for my mom, but it's no longer that day to day that was really starting to wear me down. You look at the world of stress and irritability. I know when I'm stressed, I'm irritable. I don't know about if anyone else here feels that, but I'm pretty sure I'm not alone on that, right? If you're stressed, you might be a little bit more irritable. May not be the best person to hang out with, overact to situations. And then also just feeling this world of guilt of like, oh, I should have, or I wish I could, or I should, right? Really, this world of guilt is something that comes upon people and can weigh upon us so heavily. And really finding the way to realize that, like, there's no need for the guilt. You are, like I said, I opened with, you're all doing the best you can with the hand you've been dealt. And it's not perfect. And no one here is going to be a perfect caregiver. If so, my gosh, like, I need you as my poster child for my support groups. You need to teach everyone else, but no one here is going to be, because you're going to mess up. You're going to do the wrong thing. You're going to forget an appointment. You're going to forget to pick up a prescription because these things just happen. Also looking at the world of other signs of caregiver burnout, you know, a loss of compassion, where you just get to the point where like, I don't care, either for the person that you're caring for, or maybe just for other people in your life, where that loss of compassion just disappears because you have so much on your own plate. You sort of can't deal with other people's issues or other people's struggles. So also feeling helpless, feeling the world of like, I don't know what to do. And there's nothing I can do. It's just going to be bad. Think about the world of resentment. Resentment maybe of family members, maybe being resentful of those brothers. And for any of you who are brothers, I'm not picking on you, I'm picking on the other brothers. Just want to make sure everyone knows that. So, you know, realizing, you know, that world of how easy it can be to be resentful. Well, again, why am I here? What am I doing? And then being isolated, starting withdraw, you know, from the things that you love, finding the things, realizing that what you love so much, you can't do. So you really are almost stuck in this world of caregiving and these struggles. So what do we do about this? How do we prevent caregiver burnout? We don't want this. None of you want this. This is what we are here to try to help prevent for all of you, because of the fact that it can be so detrimental to your own life and your own health. So build your support network. You know, first of all, look at your family. You know, see if you have family who's available. See if you have people who could help. All right, so if you're caring for a parent, do you have siblings? And even if they may not be the best, and maybe they cannot provide hands-on care, maybe they can provide at a distance care. This one family I worked with, it was mom had Alzheimer's disease and 3 daughters. And one of the daughters lived locally. One lived, I think, maybe about an hour away from the mom, an hour or 2 hours away from the mom, and one lived in Hawaii. So the one in Hawaii was like, I'd love to help, but I can't. Like, I literally, I just don't live there. So what she did is she picked something that she could pay for. So she paid for the home care. She's like, I can't be there. I can't provide the physical thing, but let me at least pay for something. So then this is sort of like my investment in mom's caregiving. The one who lived local is the one who obviously had to deal with the majority of the hands-on day-to-day stuff. And the one who lived a few hours away said that she would come down every other weekend to be able to take mom out and to give her other sister a bit of a break. So they created this system that worked for them. And again, not all families are able to do that, or are willing to do that, honestly. Some just aren't willing. And so, but that's how that family made it work. So think about your world, think about your networks. Think about if maybe you don't have family, but maybe you've got some really, really great friends. And, you know, if a friend asked you for help, would you help them? Right? I'm pretty sure most of us would, right? Most of us would help our friends. But are we willing to ask a friend for help? Right? Probably not as much. I always say I am a great, like, you need help, I'm there. What do you need? I got it. But if you ask me, Monica, what do you need? I'm like, no, I'm fine. Like, how many of us do that, right? It's like someone asks you, hey, Marjorie, can I help you with anything? No, I've got it. Because you get, like, it's hard sometimes also to identify what it is that you need. You're like, you want to help? Like, where do we start? You know, where do I start in terms of the world of needing help? So, but starting to look at this, creating this network, again, family, friends, neighbors. Maybe you have a neighbor who is just really there. Actually, a man in my support group, he was going out of town and he was sort of worried, like, okay, mom lived in a care facility, but he's like, I'm going to be out of town. I just want someone to lay eyes on mom. But what do I find? How do I do this? Like, I don't want to pay somebody to do this. And he was just having a casual conversation with one of his neighbors, and ultimately through this conversation, he found out that her mom is at the same care facility as his mom was. And so she said, you know what? Well, while I'm there, I'll check up on your mom for you. She's like, I'm going to go see my mom anyway. So I'll go see yours too. Like, it didn't matter to her, one extra person. And they had never had that level of a conversation. Just again, friendly neighbors. Hi, how you doing? Have a good day. Take care. One of those things. And they just ended up having this conversation, and it opened up this door where he was able to go away and knew that the neighbor would go check up on his mom when she went to go check up on hers. And realizing that there are people out there who are going to help in that aspect. Look at your religious community, see what's available there. Professionals, social workers, they are the lifeline. They help so much. Talk to your doctor, talk to your parents' doctor, if you're, or your loved one's doctor, to see what resources they have available. Do they have any? Maybe so busy and
I think we lost Monica's sound, and she's frozen in a very.
Tuesdays, which is
Okay,
tomorrow.
there she goes.
Oops, sorry about that. Can you guys hear me?
We can hear you now. Yes.
Oh, that's weird. Okay, sorry. I was just reading Aisha's chat anyway. So everyone, her information's in the chat there, regarding the support group. So that information is there. And then, if we think about, again, what are some options here? Look at, ask others for help. Create that list of things that you need help with. I personally like grocery shopping. I actually enjoy going to the grocery store and shopping. So if someone said, I can go grocery shopping for you, I'd be like, that's not really something I want someone to do. But if you can hang out with my mom while I go grocery shopping, that's actually beneficial to me. So come up with those types of ways of what I may need may not be what you need. But think about those things. Or again, go to CVS. Hey, mom's prescription is there. I'm there anyways. Can you just pick this up for me and drop it off? Mail, get things mailed, delivered. Everything can get delivered these days. So use that as well. So when you're thinking about the world of asking for help, and remember that your loved one's behavior is caused by an illness. It's not them. They wouldn't be doing this to you if they knew, if they had the awareness. So remember that it is caused by an illness, and enjoy the small victories. Sometimes that might be all you get are small victories, but learn how to enjoy them. So thinking about professionals, who are some of these professionals that can help? Senior healthcare specialists. There are geriatric care managers. So these are specialists in long-term care and planning. I always call them the professional in your pocket. So if you are caring for somebody who is aging and they have additional needs that you just may not be able to meet because you are working full-time, or you're just stretched, or you have different responsibilities, they're wonderful resources. They can go with your loved one to the doctor. They can take them to lunch. They could do whatever you want them to do, but at a high level of profession. They can also help coordinate caregivers. So they are out of pocket. The insurance does not cover the cost for a geriatric care manager, but it is something that really can be a lifeline for people, and it's usually just pay by the hour. So it's not like you have to sign up and be with somebody forever. And then they can help in case something happened to you. They could help say, oh, I know where that paperwork is. Oh, I know where that information is, in case something happens to you, because that is a very real possibility as well. Looking at geriatric medical and health professionals. So we're talking your geriatricians, your neurologists, your doctors, your nurse practitioners, who can help with medical needs. Social workers, again, people who are specializing in relationship and care concerns. And then once again, support groups. I mentioned them multiple times in lots of these presentations because we want to, get that through your head. Find a group. There are virtual groups. There are in-person groups. It's a great opportunity for you. Some other services that might be available, information and education services, where you can call like the Alzheimer's Association phone number and find out where, your local blank is, or you get just information on behaviors. Again, support groups, legal and financial assistance, respite, and respite is essentially giving you the caregiver time off. So there are sometimes respite stays that people can have at a care community. They can stay there for a week. They can stay there for a month while you are taking care of other things that you need to take care of. Maybe your own health, maybe you have a health procedure that you need to take care of. So adult daycares are also an option here in Los Angeles. We have a few really great social model day centers. There's also home care where people can come into the home to actually be able to help provide that support for you. The nursing support, the actual helping to shower, helping to bathe, much more of the hands-on care. People who help with placement, where you can find the right, a good facility, a good community for your loved one if you need to get to that point in your caregiving. And then hospice as well, which Delia is going to speak about next. So thinking about these services and thinking about how can we turn these into tools that you have, in a toolbox where you have a little bit of all of this information that can then help you on your caregiving journey as it changes, because it changes. And what now, is stuff that, your needs and your information is definitely fluctuates throughout the time of caregiving based upon your loved one's situation. So I'm going to now turn it over to Delia, and so she can continue on with her part of the presentation.
Thanks, Monica. That's a really nice segue. I just want to make sure everyone can hear me. Yes. Okay. That's a nice segue, and hopefully this, our goal is for this to really complement what Monica has shared so far. That talking about advanced care planning, palliative care, and hospice is how it kind of intersects with caregiving and thinking ahead for ourselves, how we want to be cared for, how do we want our family to be cared for. And when I say family, I'd like you to interpret that as you will. I saw in the chat, we're taking care of aunts, brothers, moms, friends as well. I use that kind of as an umbrella term to kind of capture the people that either we're blood related to or we've created as our family. So please, when I say that, interpret as you will. Allow whoever comes to mind to come to mind. And I'd like to also let you know that I've been a social worker for over 20 years, and my most recent venture is in palliative care. I work here at a Santa Monica hospital, so I'm hoping to share this information with you, and it is a benefit to you personally as well as your role as a caregiver, as a family member. So while I've been talking, maybe you've looked at this definition of what is advanced care planning, and people think about a lot of different things. They think about a lot of times I come across people directly go to end of life care or hospice, and there's so much before. Ideally, advanced care planning is done in advance when we're cognitively intact and able to make decisions for ourselves or jointly with our families. We do this ahead of time, hence advanced care planning, ahead of crisis or when we may really need this information. So the goal is to communicate with our family members when there isn't a crisis, when we can have a conversation or multiple conversations about what is important to us, what makes me, for example, what's important for me to maintain throughout my life. Oftentimes, I've been in healthcare for a while now. I remember when I first started, it was very much and in healthcare, we can do all these interventions, all these modalities, and allowing that to define what the care looks like. And I'm really excited that I think we're moving towards a shift where it's much more patient-centered. For example, I might say it's really important for me to walk my dog every day, to go outside, at least walk to the driveway or to the corner. That's a goal. Or to be able to eat pizza, whatever it is. And those things are important. So how does then the healthcare system and all its interventions support me to maintain those things that are important to me? And so looking at this from a patient-centered, patient-focused view is really exciting. And I see some of those changes in our system. So hopefully it's reflected here. So when, we want to think about what is taken into account, these things I've mentioned, and directs these conversations are what is important to us. Again, what makes me me? I want to be honest with all that said, these conversations are challenging. As Monica was describing, caregiving is challenging. It brings on a lot of emotions. It can be rewarding. It could be distressing. And I want to acknowledge that engaging in advanced care planning, same thing, there's a range of emotions for a lot of different reasons, and the process may differ from individual to individual. And on the next slide, we get into a little bit about what the goals of advanced care planning are. Do you move it, Monica, the slides, or sorry? I think we went one too far forward. There. And so I invite you to think of these ongoing conversations as an opportunity to learn about someone. And I say someone, whoever you think of, the family or whoever you're providing caregiving services for, as well as yourself. Well, things like goals of care, resuscitation, life support, and decision-making may be and need to be a part of this. These conversations are also a gift to hold. I always think about, wow, why didn't I have this conversation maybe earlier? And I hear that from families as well. I think about my sisters, I think about my mother who is living, and thinking about having some of these conversations and really getting to know each other and having that inform future decisions. That in itself is advanced care planning. So thinking about taking the time to do this and learning these details of an individual's life and what is important and how that informs future healthcare decisions can really be of benefit to both sides. And as we have these conversations and we are interfacing with the healthcare system that likes to have things documented, that likes to have things on paperwork, documentation of difficult decisions for when time comes can be really beneficial for us as caretakers, as family members, as well as for the healthcare system. Again, thinking about a moment when this information may be needed, to have a document, to have conversations written down can really minimize some of that stress that might be experienced in crisis. And with that said, I'm going to contradict myself a little bit in the sense of, I always say advanced care planning, the heart of that is the conversations, the details that in that transference of conversation. That's really the meat. So when I encounter families, they might say, we don't have the document, we were about to do it, or we were thinking about it, but I know all this information. And this person is able to give us like almost a verbatim, this whole narrative of these conversations. And that really is so helpful when we're supporting families, when we're talking through decisions, when we're talking through, some like medications or the plan of care, things like that. So know that, again, the conversations are really at the heart and the most significant part. The document is nice, but just starting these conversations is really a wonderful thing to consider. And again, these conversations and document, they really want to capture the goals, wishes, values, and beliefs that are this person. So this person is reflected in these conversations and discussions, similar to how Monica was saying earlier on, kind of finding the positive aspects of this relationship remembering those parts of this person and how that will then inform future decision making. We can move on to the next slide. So why do we do this? Why do we do advanced care planning in advance? I want to highlight that. And I'm aware that for some of you that are providing caregiving for your family members, there may be a range of cognitive abilities or cognitive status. And I want to be mindful and respectful of that. Even though I said, we engage people in this when they're cognitively intact, that's when we are able to do a document. But even as illness progresses, even if it's advancing, we can still talk to a person and what's important to you, and ask these similar questions. What's important to you? What's important to have in your life? What would you like to maintain? So I don't want to discount those opportunities of having those conversations. And I think, in kind of preparing for this, and Monica sharing her work with this organization, is that there's a lot of opportunity as kind of there's an ebb and flow in cognition. And I really want you to encourage it, regardless of status or where you fall in that spectrum or range, is that some of these conversations can still be held to elicit what is important, what is core for this person. And so advanced care planning, again, is done in advance when we're able to hold these conversations. As stated earlier, the point is to do it ahead of crisis. And so some of the reasons that we do this, and Monica kind of shared some of this, that as far as caregiving and as we move through caregiving, there might be some, emotional strain, some uncertainty and distress, some guilt or depression, anxiety, and financial concerns. Similarly, we see in findings support that it's the same with advanced care planning. When someone, for example, comes to our emergency room or an emergency room, it's been found about 50% won't be able to make decisions for themselves. So it falls on the caregiver. And if we haven't had some of these conversations, then it could lead similarly to some of these emotions, some of these situations that caregiving does. And so by default, as some of you may already know, but I'd like to share that the health system treats rather aggressively, even if it's not desired. We will do everything to sustain an individual's life and support them through this part of their journey. Again, if that is something that an individual or a family system decides, then that's part of advanced care planning as well. Either side of that coin is, for some people, they say, I want everything done to sustain my life. Let's document that. Let's talk about that. What does that look like for you? And some people say, I want something not as aggressive, or I want to be transitioned to a different modality of care. And so, yes, let's talk about that as well. So talking about the whole range of options, I'm a big believer that, and this is in part why we're sharing this, is that it's helpful to know the range of options, the range of documents, and how advanced care planning is done, for example, so that we can make well-informed decisions. And so again, we want to make, you as caregivers will be involved in this process. Karen, you've had a few comments in the box of your caregiving experience and how that can, demand a lot of things, a lot of care and attention. And so does decision making. I think that's a really big part of caregiving as well. And on the next slide, so I wanted to talk to you a little bit about the forms, the documents that are available. And one of the forms is called an advanced healthcare directive. So let's say we've had an advanced care planning discussion. I made clear kind of what's important for me to maintain in my life, how I want to be cared for, what I kind of refer to the do's and don'ts of my healthcare. Sometimes you'll hear that called, what are your wishes? What are your instructions? I kind of like instructions because I feel like that really highlights what these documents are for. It's an extension of my voice. It is what I would say on my behalf if I could do so. if I could do so when I'm unable to. So let's say I've had a conversation with Monica and I've told her, this is how I want to be cared for. This is how I don't. Now let's complete a document. So now Monica can refer to that in the event I'm unable to speak for myself. And something to note that these documents, they could be beautifully completed, notarized, everything, but they don't come into effect until I lack capacity to make my own decisions. And I think that's really important for people to know, particularly if they're aware of their diagnosis and wanting to maintain as much autonomy and control. I think that's just part of our human nature, right? And our culture is I want to speak on my behalf. And some people, they might designate, I might say, I don't want to make decisions for I don't want to be involved in all the minutia, all the details. Talk to Monica. She'll tell you everything you need to know. That's where that earlier conversation really is so important. Monica will take care of it. And so ideally, Monica and I have talked about it ahead of time, and we've agreed on that. Again, these documents, this conversation, I really think of it as an extension of your voice. And when I've shared that with people, it kind of like, okay, I still have some autonomy here, some control over my healthcare instructions. And this slide is really to illustrate that. If you were to Google California Advanced Healthcare Directives, a ton come up. It's almost an overwhelming amount. We do have a UCLA healthcare directive, and we can share that link as well. And I put it up there. And there's also one that I think really speaks to people. It's called the 5 Wishes. It's the layout is really nice. And it's I can describe it a very insightful, emotional, thoughtful document. It almost reads like a conversation. And there's also Prepare for Your Care. That one also similarly walks you through, if one, then be, and so on. It's almost like, hopefully it's almost like we're talking to you and talking you through the document. It's very user-friendly. Those 3 are very user-friendly. But again, I invite people to look at the documents, check, look at them, see what speaks to you. Again, we want this document to be dynamic, evolving, and really reflect the individual / family. Because I know that, for some family systems, we make decisions collectively, and we are so closely tied and support each other that may be reflected in this document as well. And so on the next slide, what is an advanced healthcare directive? Again, I invite you to look through that through the document. And I think that's the first step, coming to something like this and gathering this information, flipping through the document, perhaps using it as a worksheet, taking notes that you might, have for your medical team, that you might have for someone like Monica or myself, for a friend that, you might just want to bounce ideas off of and thoughts. It ideally reflects your goals and values. Again, who you are. On this document, you can choose what's called a healthcare agent. So let's say Monica and I have been friends for a long time, and I say she's agreed to be my healthcare agent, but I haven't completed a document. She's my surrogate. She can still make decisions for myself, but in this healthcare system, in this kind of healthcare land that we navigate, having that formalized is really helpful, particularly if there is not another legal connection. For example, if you're not blood related or married, this comes in very handy to have it formalized. So I can name a healthcare agent on that. I can specify any specifics as far as organ and tissue donation, and we make it legal by having it witnessed or notarized. I get a lot of questions as far as when there is some question about cognition. Should we do both? Should I get it notarized? Is it just better because there's a stamp, so it seems to give it the looks of a more legal document. It's one or the other. And on the documents, it'll give some guidelines on who can be the witness. But either one, you don't need both. And I know I'm saying a lot, so hopefully you're still with me. If there's any comments or questions in the chat, please feel free to put those in there, and we will make sure to address them. Another document is, and I should say the advanced directive, that's for anyone that's over the age of 18 and emancipated minors. You have the PULSE, the physician's order for life-sustaining treatment, and this is a specific form to California. And it is when someone comes into a doctor's office or a hospital and they have this completed, it is an actual physician's order, so it'll be written into the chart as a physician's order. This is really designed for people that have a serious chronic or terminal illness. General guideline, if they're expected to live, if the doctor were asked about life expectancy, they're expected to live maybe a year or less. And so it's for people that have a more advanced condition. And this form does need to be completed with a physician, a physician's assistant, or a nurse practitioner. And that was intentional to have those disciplines. It really pushes those disciplines to have conversations with their patients, or and have conversations about how the person would like to be cared for. And this can be completed with either the patient themselves, or if they don't have capacity to do so, a representative. So a family member, a caregiver, the person that's been designated their representative. So some people that don't meet that 1 year mark, they don't have a prognosis of a year or less. Sometimes I still do educate them on this form, because I think it is, I want to say a good springboard, but a challenging springboard. I want to emphasize that it's hard. It's a challenging springboard, but a good kind of framework of when you're talking through how you might want to be cared for, is looking at this, you see what the healthcare system has to offer, if you will. And does that fit for me? Are these interventions that I would be accepting of? Would I be accepting of for this person that I'm taking care of? And so again, this can be used as a worksheet to ask questions, reflect on, and not to underestimate the challenging aspect of these reflections. And so that's, in summary, the PULSE. And you can have both the PULSE and an advanced directive. If possible, advise to have both. And I think that's all I want to say about PULSE. On the next slide, you'll see the advanced directive and the PULSE side by side, just to see it in a different way, how they are different, how they complement each other. PULSE is really for the current care. Should someone come through the hospital, should someone present in their doctor's office, and that really stays with the patient. Single standardized form, whereas the directive has multiple options, multiple versions, still the same intent, still the same purpose. So that's just a slide to give you a different visual on what we've been talking about. So I wanted to touch on, to complement what Monica was talking about earlier, was the supportive services, the different resources and supportive services that may be available. As in the next slides, I'll talk more as far as palliative care and hospice, but I wanted to present this slide because I get questions a lot about what home health is, palliative care and hospice. Do they work together? Can I have them all? How do these work together? And so I just wanted to quickly highlight these, not to get into the weeds specifically of what they offer. But I think some of you may be familiar with home health or home care, is, when the doctor orders for a nurse, and it could be accompanied with with rehabilitation services, perhaps a social worker, and they come to the home. We see it more so, kind of check in on vitals, medications, things like that. And you can have home health and palliative care together. And palliative care and I'll get into more detail about that. It is a specialized service that focuses on supporting a patient and family caregiver through serious chronic condition, whether curable or not. And that's to highlight that we can come into the picture at any point in the disease journey and the healthcare journey. The goal is to manage pain and symptoms, as well as provide support, as Monica was also mentioning earlier in the presentation, through any stage of illness, talking through changes in condition, talking through interventions, talking through decisions that may be on the table, talking through as well new diagnosis. Some of you on the line might, have learned of a new diagnosis. And so what does that mean for you, for us? Let's talk through what we know so far and come up with a plan. And treatment, I really want to highlight treatment can be pursued while on palliative care. That's a question that I hear a lot. And that when I hear that, that clues me in that I think people are using the words palliative and hospice as the same, as synonyms, but they're a bit different. While both services focus on comfort, care, and also quality of life, and both require a serious illness. For hospice, what really starts to separate it from palliative care is that this person is approaching the end of their life. They've been estimated to have a life expectancy of about 6 months or less. Sometimes people exceed that on hospice. I've seen that quite a bit, but that's kind of the guesstimate based on, the patient's presentation, what we all know as professionals and research, but patients prove us wrong all the time. I love it when they prove us wrong. And so it may be longer than that. And I think a big difference too is that under hospice, this person and or family has decided not to come back to the hospital. They've decided that home, and again, home, define that environment as you will. It could be a skilled nursing facility, assisted living center, extended care, could be at a house. They've decided to stay in their preferred setting. So they're not coming back to the hospital anymore. And I see some comments in the chat. Yeah, agree. Palliative care is often used instead of hospice and not explained. And if you feel like there's any gray there, like you might remember this presentation, please ask. That's a big part of our role, is really clarifying those definitions and educating. I feel like that's one of the biggest sources of support or intervention that we can give families, is really coming alongside you all and providing you education and information that will help you through the different phases of caregiving. And if I could address this question, is my mom's poll still valid if the doctor's signature is no longer her primary care physician? Yes, as long as it was signed by a physician, and all the parts are signed, then it is a valid document. I will advise just quickly, if she has a new physician, it might be worth just reviewing it with that physician and making sure that physician knows this is what we completed, and making sure it's still current. But yes, even if that doctor is not still the primary doctor, it's still valid. Good question. And this is just another way to illustrate the services that I've been describing. I was sharing with Monica, some of us are more visual learners as opposed to the lecture or what's on the slides. And so just showing you, illustrating the continuum of care and how these services complement and segue into the other. And so where you see the the curative care, I would substitute that. I would prefer to say managing care or managing the care as opposed to curative, because a lot of times, you know, certain diagnoses are not, there isn't a cure, but we're managing in order to promote quality of life with intervention, with medications, just a bit to maximize that person's quality of life. And you see how there's palliative care in the purple, and then there's hospice. And so that's where we become a bit more comfort care focused. We want all our patients to be comfortable, but it's a bit different when we get into that darker purple. And so that, yeah, just want you to note how early palliative care can be involved. We really, I think, strive for earlier intervention, but I think a lot of times the hospice and palliative care gets a little bit merged together, and that can be kind of scary if we're not ready to hear that, if we're not ready to hear these words. But palliative care, you know, has been found, the earlier we can be involved, the better symptoms, and including distress and anxiety, those emotional symptoms can be managed. It really promotes quality of life. So I really invite you to consider that as we're moving through, you know, the next steps of care. So I just wanted to emphasize the definition of palliative care, you know, what palliative care focuses on, you know, that treatment can also be pursued to cure or manage your disease at any time, any point of the disease process we can enter. You know, I've provided you with definitions of commonly used services. Again, want to highlight this definition to clear up, you know, any misunderstandings and any kind of demystify it as well. As I was preparing for this presentation, I just did a Google search of, you know, palliative care, and palliative care is often coupled up with hospice. And so thinking outside of my role, I could really see how that is confusing, and hopefully that confusion leads to, you know, conversations where we can clarify what services are available for you and your loved ones. Because we don't want these misunderstandings to be barriers when considering, accepting, or accessing services that can otherwise be beneficial and potentially even decrease some of that the burden of caregiving. And I use the word burden as respectfully as I can. I think as much as we may love or are invested in caregiving, it does take its toll. I think that's something worth sharing and saying. And that in itself can complicate decision making somewhere down the line. And so for palliative care here, in addition to the definition, I also wanted to illustrate how we can be of help. When we come into the picture, what is it that we do? You know, sometimes I walk into a patient's room and I say, I'm, you know, introduce a palliative. Well, what do you do? What is this? And so we really strive for better symptom management, pain, any other symptoms that the patient may have. We really want to strive for more time at home, less time in the hospital. If we can manage some of these symptoms, and if we can manage some of these needs that are presented to us, can this person spend more time outside of the hospital in a way that promotes quality of life? We really want to assess and address emotional, psychological, and spiritual needs. So palliative care is really a team sport with chaplains, social workers assessing for these needs. And the patient may be presenting this, but we know that the caregiver has a parallel process that can reflect a lot of that as well. In, you know, the same maybe emotional needs, psychological needs, spiritual needs, isolation. And so we want to tend to that caregiver as well. Because if one is doing okay, the other one's doing okay. One's doing better, the other one's doing better. We know those go hand in hand. We also assist with inter-physician communication. Oftentimes, a patient may have a multitude of providers. Are they communicating? Are they sharing information? How can we facilitate that communication? Oftentimes we get caregivers saying, we asked for, I don't know, you can fill in the blank, I'm sure. We asked for this service. Well, let's talk that through and see if we can get you connected, get you that, another maybe MRI or that neuroconsult, whatever it is. And we can help with that communication and perhaps clarify any misunderstandings. We're all ideally working towards the same goal of keeping the plan of care patient focused. So we want to help with that communication. And we want to offer support and guidance with decision making. As caregivers, are you all receiving the information that's needed to make decisions? Is there confidence and security in that communication? So we want to make sure that you have that. And all these parts added up point to, ideally quality of life for the caregiver and the patient. I think one before that. And with all that said, a lot of questions I wanted to just quickly highlight, some of the questions that I get after we describe our services, that who pays for this? And so this is a service that's covered by your insurance. And there is Senate Bill 1004, which is California law that also requires Medi-Cal. So if you do have Medi-Cal, and Medi-Cal managed plans to provide access to palliative care. So there's really been a move to make this service accessible. And so how do you explore this? If you'd like to have more information, this service does require a referral from a primary care provider, a specialist or hospital provider. Anyone can ask for it. And so you can have an initial consultation and see, if this fits into the plan of care. You can also check with your insurance portal. You can look for palliative medicine, palliative care, and that may come up on who you can talk to. And I put here, again, it's a request. So if your provider does not offer this service, but after hearing this presentation, you might think, this might fit into the plan of care. I want to explore it. I want to see if this service might be beneficial. You can ask your provider, and I highlight there, some persistence may be needed. Some providers, may say right now is not the time. And that prompts me to, they're thinking maybe about hospice and end of life care, where we're taking quite a few steps back from that. So you might, want to say, I heard this presentation, want to learn more about how palliative can help with, again, fill in the blank, pain and symptom management or discussions, support, those sorts of things. So you might need a little bit of persistence, and it may be through a course of 1 or 2 conversations with your provider to get that consult. But I really, or that referral, I should say, but that persistence hopefully will pay off if the service is of benefit to you. And so in summary, with all of this is hopefully to give you information for really, we're planning for tomorrow, so we can have some peace of mind today that we've talked about these things, that we've explored these things, as challenging as they can be, so we can really thrive as best as we can today. And I think on the next page, Monica, maybe you can join me with this. These are some resources that we have that we'll be sharing with you. On the second half is just related to my portion of the presentation, some websites where you can look for more information. I think gave you kind of a quick overview, but here it gets into much more detail and some scripting as well, as far as how to talk to providers about this service.
And some of the information on the top, just some local LA-based resources for you. The Alzheimer's Association, Alzheimer's Los Angeles. So we have 2 different organizations here in LA that both provide Alzheimer's support. And then there is the Los Angeles Caregiver Resource Center, And so those are also just some great local resources for you. Then I'm just putting the email addresses in the chat. I forgot to update the slide after our after our presentation, so that you can have the resources as well.
And I realized I didn't put the numbers. I think for the last two, it's primarily web. It's the web page, but on the UCLA website, there are numbers that if you required more information, you can get our, and our administrative assistance as well on there.
Then I think we want to open it up and see if anyone has any questions of or any additional information that we can help you with or support you with as well.
I have a question, please.
Yeah, go right ahead,
Yeah.
Michael, please.
Thank you. This is really a great load of information. So ladies, bless you. Thank you so much. My family is in San Diego County. Is there a counterpart to what UCLA and LA County or LA City offer?
I know, are you carrying it, let's say, is it, does your loved one have dementia or memory? Because if it's dementia, they'll give you, I know dementia resources down in the San Diego area.
Okay. I will have to say that the Alzheimer's Association was very helpful. We had to get my mom a senior ID since your driver's license had elapsed 10 years ago. And they were a great resource and very accommodating.
Great. Yeah, no, I have
Great.
some additional information that I can either, if you want, I'm going to put my email address in the chat right now. So you can shoot me a quick email and then I will respond with some additional resources for you, Michael.
Excellent. Thank you so much, Monica.
You're welcome.
Were you curious about the specifically Alzheimer's resources, or were you interested in other, like any other resources, like from my end? Would you like my contact information, or?
I say definitely put it in the chat. I
I'll put it in the chat. Sure.
Yeah.
And also, Aisha will definitely be sending a follow-up email that will include all of the things that have been listed since the beginning of the presentation, and anything else that has that may not have made it in. Aisha did have to step away. Anything that she was not able to get in there, as well as Delia's and Monica's contact information. So I think you guys should be covered pretty well.
Great. And we know that, like, even after, you take this information, it kind of digests, you might have more questions after. So
true.
We hope it does. We hope it provokes thoughts and more questions.
Yeah, and also just sort of a little note, just because I know Karen, you wrote in here that you aren't in California, but just saying that lots of these resources really are available, luckily in most states, and I think ultimately lots of like the larger cities as well have these. And so I always look at any sort of like academic institution is really where you're going to find lots of good quality information. So many places have Alzheimer's research centers. I know hospice and palliative care are really things that are being promoted a lot through different medical centers as well. So most places should have this information in terms of whatever is local to you.
Yeah, there was a caregivers conference here that I attended not too long after I got into town, which was very comprehensive.
Great.
Great.
That's always nice to hear, because sometimes you hear the exact opposite. So that's nice to hear.
Yeah, I was actually shocked because I'm in the Detroit area and actually in Detroit, and I was amazed at how many resources are available for a broad range of things here that didn't exist, when I left at 18.
That's great.
Great. Marjorie, I saw your hand up. Oh, but you're muted now, so just unmute.
Hello.
Here you go.
So, thank you so much, everyone. Uh, I guess I would stick immediately because my head gets confused with too much information. People said it's so valuable, but I just get swamped. And
I think you might be breaking up a little, or is it just my audio? You're breaking up a little, Marjorie.
Yeah. Mhm. Maybe Marjorie, you can either call our office with your question, or it sounded like it was quite long to type out. I don't know if you want to put it in the chat or we want to get you an answer, but yeah, it was very garbled. I'm not sure what's happening with, maybe your microphone is having some issues.
Can you hear me any better now?
Much better. Much better.
Yeah.
Mhm.
The only problem is I can't hear you, but never mind. Anyway, I will contact Monica. Thanks. And maybe Delia later, but one person, thanks.
You're welcome. Now that you put your headphones on, we'll respond back with you're welcome. However we can help, we're happy to.
I don't see any more questions in the chat. I see lots of thanks. Thank you, thank you, thank you. Very helpful. Thank you. Great info. Thank you, thank you. Yeah, nice. I agree 100%. Thank you very much to Monica and Delia. And thank you to those of you who attended. I think you guys are to be commended. I'm not quite sure why more people didn't. I'm gonna hope that it's because they weren't available, because the information is certainly valuable. So yeah, thank you guys all so much. Anything else before we close?
I have a quick question.
Yeah.
I'm just curious what kinds of things folks are doing to help their loved one kind of reconnect with happy stuff. What people are doing in your lives. I'll just offer one. When I visit my mom, typically we'll play some music of her choosing, and I'll sing and dance and do some really goofy stuff that gets her laughing and smiling. But I'm just wondering what are folks doing just to help keep some joy in the experience.
Yeah, I think music is one of the biggest things that I hear of people talk about, just how wonderful music is. There's an organization that I know is called Laughter on Call, where they actually do like humor. And for caregivers, for people, again, we all feel better after we've had a good laugh, right? The endorphins in our bodies definitely raise. I know sometimes too, if someone has dementia, if they're really unable to communicate, sometimes it's that world of like sensory stimulation helps a lot, where like with like lotions, lavender type lotions, that again, remembering also the power of touch. I think sometimes we forget about the power of touch, and how if you really sit with your mom and maybe just put some lotion on her hands and have some nice music going in the background, how that really can be beneficial, can help with circulation. It can have lots of other benefits aside from just making you feel better. So things like that are good as well. Trying to get out, again, depends upon ambulatory status, but getting outside and going for a walk, or if they're in a wheelchair, push down the street, go to a park. So it's often, sometimes it depends upon what the mobility is. But really, I always encourage, if your mom, if there's ever an opportunity to get outside, like get outside, even if you have to put a bunch of blankets on her. Because I know as people get older, they're cold, no matter how, what the temperature really is. It's like they're cold a lot. So it's like put some blankets on and just go outside. The vitamin D and the sunshine can really have such positive effects. And then if there's kids, like people love kids, it's like if you have kids around, bring the kids. Don't be afraid to bring children into your loved one who might be older or who's sick or who's frail. Don't be afraid to bring your kids. I remember going to see my 101-year-old great grandfather in his nursing home back in the 80s. And like, yeah, was it a little off-putting for kids when other people are like sort of reaching for you because they're so excited to see these kids? But you think now about like the joy that brought these other people. So if there are children, I think I always try to encourage that, like, don't shield them from this. It's important that they are there as well, because they bring joy, and it's also good for them to see, the whole cycle of life. Even, how hard it is. We want to protect people, but, unfortunately we can't forever. So I think it's a good thing to bring them around.
I agree with you, Monica. I think one of the things that when I walk into like there's it could be one person or a room full of family members, the conversations that they have, like they could just be having regular conversation, like you're describing, the kids are making noise, they're talking about whatever it is. I think that is something that no one can bring into, I am thinking of like a patient room, but it could be any setting. That's something that families can provide, just kind of having that person in the middle of all of that. I think there's such great benefit on both sides for that. And I think, Tony, you mentioned music. I think music is such a beautiful therapeutic, it reaches so deep into a person. I think having that available is a wonderful gift and intervention.
Mm-hmm. Karen, I see you have your virtual hand up.
Yeah. I was just going to say, in answer to Tony's, that I do similar things. I try to get her out to like art museums. She's pretty mobile. But when we go out in public, I do have a transfer chair. So she can either use it as a walker, or I can, push her along. And we went to like the Van Gogh exhibit, and we go to the Philharmonic outside. We go to the Ford Estate, which is a beautiful property, and they have all kinds of different activities going on in a place that you could just walk. You just get a day pass and just walk around. So I'll do those kinds of things. And also, weirdly, she's not a person for television, but she does like the news. And then we've been watching, Wheel of Fortune and Jeopardy. And you'd be surprised, she answers some of the Jeopardy questions correctly. And I'm like, okay, go Aunt Lottie. So, just things like that might, I'm trying to do activities. She has low vision, so she can't see anything. So she can't do puzzles. She can't do word searches, but, we could do stuff like that. She can look at Wheel of Fortune is big enough to, to kind of, and she's a great conversationalist. So sometimes it just takes just having a chat. So, but yeah, we do. I just try to find all kinds of crazy little things to go out and do. Come on, we're going to go do this. Sometimes it's, she's kicking and screaming and doesn't want to go outside, but I'm like, no, come on, let's go do this. So anyway, that's what I do.
Great. And I know, let's say also, and I know time, we are at noon, top of the hour, but also if any of your loved ones do participate or could participate in virtual programming, I know places are doing virtual programming for people with dementia. In West LA, there's an adult day center called Opeka, and they have a program that is virtual, a day program. So that is a really great resource as well. I know the LA County Museum of Art has I believe it's twice a month. They have like virtual Fridays where they take people, like it's dementia focused, but it's a virtual engagement with art. Those definitely exist as well.
It looks like Alice has also put another resource in the chat, and yeah, if you guys get a chance to take a peek at that.
Great, thank you, Alice.
Okay. Anything else before we close?
Many thanks again, both to you and the ERRC and to Delia and Monica.
Yeah. Thank you, Michael.
You're welcome. Thank you all for participating.
Yeah,
Thank
thank you,
you.
everyone.
Today. Thank you so much.
Thank you, Monica. Thank you, Delia.
Bye, everyone. Have a great day.
Bye-bye. Take care.
you.